What if I told you that right now, as you're watching this video, there's a force inside your body that's either protecting your organs or slowly destroying them? And here's the scary part, you probably can't feel which one it is. Today, I'm going to tell you exactly how to measure, understand, and control this force. And yes, most of you can actually reverse the damage without medicines. I'm Dr. Kaustubh Dabhadkar, a cardiologist who's seen thousands of patients transform their health by understanding one simple number. But here's what's shocked me. A lot of people often measure their blood pressure wrong. So stick around because in the next few minutes, you'll learn more about blood pressure than most people have learned in their lifetime. Let's start with what nobody explains properly. Blood pressure isn't just a number. It's literally the force your heart has to overcome every single time it beats. Imagine pushing a heavy door that gets heavier every year. That's what your heart is doing 100,000 times a day. When we say your blood pressure is 120 over 80, the 120 is the number that's generated by the heart by pushing blood through your arteries. That 80, that's the pressure when your heart is resting between beats. But here's the critical part. This is also the pressure battering your kidneys, brain, and eyes every second of the day. Think of it like water pressure in old pipes. Too high for too long, it's going to start damaging your organs. Now, the system that regulates blood pressure involves your brain, your kidneys, and your blood vessels. Plus, there's 50 different hormones. It's insanely complex. But here's the beautiful irony. While the system is complex, what you can't control is remarkably simple. And I'm not just talking about theory. Studies show that up to 70% of people with mild to moderate hypertension can come off their medicines completely with the right changes in your diet and lifestyle. I've personally guided hundreds of patients through this process. Here's something most people don't know. Your kidneys are the master controllers of blood pressure. They produce hormones that either raise or lower your blood pressure based on what they think your body needs. The main player, the renin-angiotensin system. When your kidneys sense low blood flow, they release renin, which triggers a cascade that tightens your blood vessels, makes you retain salt and water, and increases your blood volume. It's like your kidneys have a thermostat. But sometimes that thermostat gets stuck in the high position. So why does blood pressure rise? Let me break down the actual mechanism. The first one is the arterial stiffening. Your arteries are supposed to be like elastic bands, stretching with each heartbeat. But with age, poor diet, inflammation, they become like rigid pipes. Your heart has to pump harder to push blood through these. Number two is the volume overload. Too much salt just doesn't make you thirsty. It forces your body to hold on to more water and dilute the salt. More fluid in the closed system equals higher pressure. Basic physics. The number three thing is the sympathetic overdrive. Chronic stress keeps your fight or flight activated. This releases adrenaline and cortisol, which constrict your blood vessels, increase your blood pressure and your heart rate. And number four is the endothelial dysfunction. The inner lining of your blood vessels produces something called nitric oxide, which relaxes your vessels. If you damage this lining through diet, smoking, inactivity, you lose this natural blood pressure lowering mechanism. Now here's where it gets really interesting. Even in your doctor's offices, the blood pressure is probably measured incorrectly. Let me tell you what's often happening. So some of the common mistakes are, number one, someone's checking your blood pressure while you're talking. This will raise your blood pressure by 10 to 15 points. If you're sitting with your legs crossed, that adds a few points. If your arm is unsupported and just left dangling, it will add a few points to your blood pressure. If you feel the need to urinate and your bladder is full, that adds a few more points. And here's the fifth one, but probably the commonest that I've seen. Your blood pressure is often checked over your clothing. That easily adds 10 points to your blood pressure. The right way to check your blood pressure is when you walk in, just sit quietly for about 5 minutes. Your feet flat on the floor, your back supported, and your arm at the level of heart supported on a table. Ideally sort of around the height of the dining table. And make sure the cuff that you're using is the proper size. Wrong size of cuff can increase your blood pressure by up to 20 points. When your blood pressure is being checked, no talking, no phone, relaxed breathing. Take 3 readings, 1 minute apart. Average the last 2. Here's a secret from my practice though. I trust your home readings more than your office readings. Why? White coat syndrome is real. Up to 30% of people have normal pressure at home but very high readings in the office. The gold standard is usually Measure the blood pressure at least twice every day for about a week. Every morning, 30 minutes after you take your medicines, which is typically 30 minutes after breakfast, and every evening, about 30 minutes after dinner. I'm assuming people take their medicines right after their breakfast or dinner. Now, this gives us 14 readings. That really show you your true pattern. One high reading in my office, that's a snapshot. Your week of home reading, that's a complete movie. So how do we actually reverse this? Here's the exact protocol I use with my patients. Number one is the DASH approach. The DASH is not a fad diet. It's specifically designed for blood pressure. You have 4 to 5 servings of fruits every week, 4 to 5 servings of vegetables, whole grains, lean proteins, especially fish, minimally processed foods. All of this should help reduce your blood pressure. The second is the sodium strategy. It's not just less salt, it's smarter salt. Try to keep your sodium intake below 2300 milligram daily or 1500 if you're salt sensitive. Now, most of us are not walking around trying to measure how much sodium we're eating. The easiest thing is read all the labels. You'll be surprised, but some of the breads actually have more sodium than potato chips. Restaurant meals often have a full day sodium. The best way to reduce sodium is to be very conscious of what you're eating and minimize any salt that you can from your diet. The third thing, and a very important thing that I tell my patients, is the movement prescription. 150 minutes of moderate cardio weekly. But here's the key. Consistency beats intensity. Every 10-minute walk after meal makes a huge difference. The fourth thing is the weight factor. Every 2.2 pounds of weight that you lose brings your blood pressure down by about 1 point. You lose 20 pounds and that's better than actually taking a medicine. The fifth thing is very important, often ignored, is the sleep-stress connection with the blood pressure. Poor sleep directly raises blood pressure. Chronic stress keeps those kidney hormones very high. I'm all for lifestyle changes, and if you make the above 5 changes, most of the people will never need blood pressure medicine. And I'm all for it. But let's be clear. Sometimes medicines are absolutely necessary. Blood pressure that's consistently remaining over 140, over 90, despite all the above lifestyle changes, you are going to need blood pressure medicines, at least temporarily, until you can bring your blood pressure down with all the lifestyle changes. Any readings over 180, over 120, when you're at rest, you have to think of going to the emergency room at that point. If your readings are staying over 180 or 120 for prolonged duration, could result in organ damage. If there's any evidence of organ damage, we usually check it by checking your proteins in your urine, or we check for enlargement of your heart using an echocardiogram, which is an ultrasound of the heart. You are going to need blood pressure medicine. People who have diabetes or already have kidney disease, we prefer to start blood pressure medicines earlier because they are at a very high risk of damage to their organs. Think of medicines as just buying time while you work on lifestyle changes. It's preventing strokes and preventing heart attacks while you reverse the underlying causes. Here's exactly what I suggest that you do after this video. Get a home blood pressure monitor, upper arm, automatic, use a validated model. Number 2, start tracking twice daily for 1 week, log it down, that's the best way to do it. Number 3, share these readings with your doctor. Bring your blood pressure log to next visit. A lot of patients are good about checking their blood pressure, but when they come to the office visit, they don't have a log. So we cannot act on the information that we don't actually have access to. Remember, with blood pressure, you're not just managing a number. You're protecting your brain, your heart, your kidneys, and your eyes from irreversible long-term damage. And yes, most of you can reverse this. If this has helped you understand your blood pressure better, hit subscribe for more evidence-based cardiac health content. And remember, the best time to start was yesterday. The second best time, right now. Thank you for watching.